Hi everyone, Monica Moore, nurse practitioner at now Illume Fertility, our new name, which is very exciting. And in this edition of Ask Monica, we are going to talk about, as you can see on the board, two different types of pre-genetic testing. The first one we've covered in a previous talk, and it's PGT-A, so pre-genetic testing for aneuploidy. But today we're going to talk about a different one, and it's pre-genetic testing for, this M stands for monogenic disease, which is basically a fancy way to say we're testing for a single certain gene. And usually when we test for this, it's because there is a family history of having this disease that can be clinically significant, sometimes lethal. Often when we first did PGT-M, it was because of diseases like cystic fibrosis. There was a strong family history of cystic fibrosis, so we wanted to only replace embryos that were tested that either did not carry this gene or were a carrier for this gene, but not what's called affected. So in order to be if you are affected, that means that you will be likely to develop the disease. So another disease that we did this for often was an adult onset disease called Huntington's disease, where you may not be symptomatic until, as I implied, you're an adult, but we can still test to see if you carry this gene. So as we got better at doing embryo biopsy, which is necessary in order to do PGT, and we got better at developing these probes that were able to test these genes, we started to apply it to more diseases, such as more adult onset diseases. And some of the ones that we get asked about frequently are for the genetic forms of cancer. One of the most well-known is BRCA 1 and 2, which if you carry the gene can, but doesn't always lead to breast cancer or ovarian cancer, cancer of the reproductive organs in women. So we can do PGT-M, or IVF centers can do PGT-M for this, to see if the embryo is a carrier for this gene. The difference is that just because you're a carrier for this gene doesn't mean that you're going to go on to develop the disease. But knowing this information might then offer that person who's a carrier different testing. They may end up making some changes in their reproductive journey based on this information, or you don't transfer an embryo that carries the gene, and you would only transfer what we call unaffected embryos. So at Illume Fertility, we offer both of these, as do many other centers. And the great majority of the pre-genetic testing we do is for aneuploidy. Do we have the correct number of chromosomes? As we went over before, it'd be 46XX, 46XY. But what we're talking about today is, I never get that in the picture, is a little bit different, where we're just looking at a single gene mutation. And like I said before, we look at that for cystic fibrosis, Huntington's disease, and are starting to do it for some hereditary forms of cancer. So hope that's helpful. As always, please feel free to email us or DM us or write in the comments any of your questions or concerns, and have a great week.